Now I will move to the second part of my lecture, in which I will focus on two examples of enterobacteriaceae that causing an infection outside the enteric tract. These are Klebsiella and proteus. Let's start with Klebsiella. Klebsiella are gram-negative, rod, non-spore forming rods, facultative anaerobes, oxidase negative. The question is, what is oxidase? An oxidase is an enzyme that catalyzes an oxidation reduction reaction, especially one involving dioxygen as the electron acceptor. In reaction involving donation of a hydrogen atom, oxygen is reduced to water or hydrogen peroxide. Klebsiella also lactose fermenter form pink-colored colonies on McConkey agar. Presence of polysaccharide capsule in the culture plate, mucoid colonies are seen. Non-motile. They can be found singly, in pairs, or in chains. What is Klebsiella antigens? Klebsiella have two types of antigens. These are O antigen and K antigen. O antigen is a component of lipopolysaccharide, of which 9 variants exist. K antigen is a capsular polysaccharide with more than 80 variants. This slide shows the disease that's caused by Klebsiella. Klebsiella are found in the human nose, mouth, and gastrointestinal tract as normal flora. However, it behaves as an opportunistic human pathogen, causing pneumonia, urinary tract infection, sepsis, meningitis, diarrhea, and soft tissue infection. Klebsiella species have also been implicated in the pathogenesis of ankylosing spondylitis and other spondyloarthropathies. There are many species of Klebsiella in humans. 3 species in the genus Klebsiella are associated with illness in humans. These are Klebsiella pneumoniae, Klebsiella oxytocin, and Klebsiella granulomatis. The majority of human Klebsiella infections are caused by Klebsiella pneumoniae followed by Klebsiella oxytocin. The virulence factor in Klebsiella are capsule, which is antiphagocytosis, cell wall receptor, lipopolysaccharide endotoxin. Also they have membrane and siderophores. What is siderophore? Siderophore are low molecular weight molecules that chelate iron with a very high and specific affinity. Many bacteria, both gram-positive and gram-negative, produce and secrete siderophores to scavenge iron from the extracellular environment. Siderophore iron examples are transported into the cell through a receptor in the membrane. In gram-positive bacteria species, a putative cell surface lipoprotein receptor anchor in the cytoplasmic membrane through its N-terminal lipid moiety, and an ABC type transporter are required for the transport of siderophore iron complex. Siderophores, along with other iron acquisition systems, are virulent factor in many bacterial pathogens. The route of transmission. Acquired Klebsiella are acquired in the hospital setting or in long-term care facilities. In fact, Klebsiella account for up to 8% of all hospital-acquired infections. People with a compromised immune system and or people who have an implanted medical device, such as a urinary catheter or airway tube, are more at risk for Klebsiella infection. Extensive use of antibiotics has resulted in the development of antibiotic-resistant strain of Klebsiella. What is the treatment available for Klebsiella infection? Because the antibiotic resistance of these organisms, the choice of a drug depends on the result of sensitivity testing. Isolated from hospital-acquired infection are frequently resistant to multiple antibiotics. An aminoglycoside, example gentamicin and acefalosporin, example cefotaxime, are used empirically until the results of testing are known. Okay, let's move to talk about the second example of enteric organisms that cause an infection outside enteric tract, which is proteus. And let's start with characteristic features of proteus. Proteus are gram-negative, rods, motile, aerobic, and facultatively anaerobic. Urease positive, and we explain what urease do to the body when excreted by bacteria or other microorganisms. A striking microbiologic characteristic of a proteus species is their swarming activity. And let me explain what is swarming activity. Swarming phenomenon appears macroscopically as a concentric ring of growth emanating from a single colony or inoculum. On a cellular level, swarming results from bacterial transformation from swimmer cells in broth to swarmer cells on a surface, such as a gutter, in a process involving cellular elongation, and increased flagellin synthesis. There are many species of proteus. These are Proteus mirabilis, Proteus vulgaris, Proteus bineri, Proteus moxophysian, and Proteus hauseri, and 3 unnamed genomospecies, Proteus genomospecies 4, 5, and 6. What is the disease caused by Proteus? This slide shows the diseases that are caused by one species of Proteus, which is Proteus mirabilis. Proteus mirabilis is a common cause of both community-acquired and catheter-associated UTI, urinary tract infection, cystitis, pyelonephritis, prostatitis, wound infection, and burn infection, and occasionally causes respiratory tract infection, chronic suppurative otitis media, eye infection, meningitis and meningoencephalitis, bacteremia following catheter-associated urinary tract infection, cellulitis, endocarditis, mastoiditis, empyema, and osteomyelitis. Proteus mirabilis could have a role in the etiology of rheumatoid arthritis. Now this slide shows the disease that caused by other Proteus species. There are so many diseases caused by other group of Proteus. These are urinary tract infection, wound infection, burn infection, bloodstream infection, and respiratory tract infection. Proteus vulgaris causing bacteremia and brain abscess. Proteus moxophysian was originally isolated from a gypsy moth and has been isolated from urinary tract infection in India. Proteus hauseri has not been associated with infections in humans. Now let me explain the virulence factor that's used by Proteus to produce disease. There are many virulence factors used by Proteus. These are villi or fambry, used for adherence to uroepithelium. They elaborate also cytotoxic hemolysin that lyse red cells and release iron, which is as a bacterial growth factor. Also, they have flagella for motility, and they produce urease, leading to the formation of starvite stone. Epidemiology. Proteus are widespread in the environment, found in the human gastrointestinal tract. After we know all the keys of these enemies, Let us know what is the treatment that's available now and used against this species. Most strains of proteus are sensitive to aminoglycoside and trimethoprim, sulfamethoxazole. But because individual isolates can vary, antibiotic sensitivity tests should be performed. Proteus mirabilis is the species most frequently sensitive to ampicillin. The treatment of choice for indole-positive species is a cephalosporin, example, cefotaxime. Finally, thank you for your listening.